Have you ever noticed how back pain slowly takes over your day after 40? How it begins with stiff mornings and then becomes pain while walking, then sitting, then even resting, until one day you realize you plan your whole life around avoiding pain. And what if most people are fighting their back pain the wrong way without knowing it, pushing through exercises that actually make the pain worse? What if just two very simple movements could change how your back feels again and help you move with confidence instead of fear? In this video, you will learn why long-lasting back pain becomes so common after 40, why most exercise routines fail people in this age group, and exactly which two surgeon-approved exercises are often recommended to support the spine in a safe, gentle, and realistic way, especially for adults between 40 and 70 who want to stay active, independent, and aware of pain without extreme workouts or dangerous movements. This video is for you if your back pain has made you afraid of bending, walking, sleeping, or even standing up from a chair, and you feel upset because nothing seems to work for the long term. Before we talk about any exercise, it is important for you to know that this guidance is not based on personal opinion or internet trends, but on many years of scientific research and expert advice from spine surgeons, physical therapists, and rehabilitation experts who study how the back really works as we age. Because research clearly shows that most long-lasting back pain after 40 is linked to muscle weakness, less spinal support, and poor movement habits, rather than serious injury. And studies published in orthopedic and rehabilitation journals have shown that focused low-impact exercises can greatly reduce pain, improve movement, and protect the spine over time when done correctly and regularly, especially when compared to aggressive stretching or very intense routines that often increase pain flare-ups in older adults. What surgeons and spine experts now agree on is simple but very important. The aging spine responds better to stability, gentle strength, and controlled movement, instead of force or extreme positions. And that is why in a moment I will introduce two exercises that focus on supporting your spine, instead of putting stress on it. Exercises that are commonly used in rehabilitation programs because they are safe, practical, and effective for people after 40. Before we go deeper, here is a quick preview of what is coming, so you understand why it is worth staying until the end. You will learn why most back pain routines fail older adults, what these two exercises are and why surgeons often choose them first, how to do them safely, even if you are a beginner, and how small daily effort can slowly change how your back feels over time. Not overnight, but in a realistic and lasting way. And before we start, if you want to stay active, strong, and independent after 40, 50, or even 60, subscribe to EverFit Guide and tell me your age and where you are watching from in the comments. I read and reply to every comment. And now let us begin. One of the biggest reasons back pain becomes long-lasting after 40 is that many people unknowingly weaken the muscles that protect the spine, while making the joints stiff that need gentle movement. And as we get older, research shows that the deep core muscles and glute muscles slowly lose strength if they are not used on purpose, which means the spine takes on more pressure during daily activities, like standing, lifting groceries, or walking. And when people feel pain, they often stretch too hard or stop moving completely. But studies in physical therapy show that too much stretching can irritate sensitive parts of the spine, while too much rest causes even more weakness, creating a cycle of pain, fear, and inactivity that feels very hard to break. Surgeons often see this pattern in patients who come in worried they need surgery. But scans often show age-related changes that are normal and not the main cause of pain. And this is where the right kind of movement becomes very important, because strengthening the correct muscles in a safe way helps reduce pressure on the spine and brings back confidence in movement, which research shows is a key factor in reducing long-lasting pain. The first exercise many spine specialists recommend is a simple core support movement often called a modified plank or abdominal brace. But do not let the word plank worry you, because for adults over 40, this exercise is done gently and with full support, usually lying on your back with your knees bent and feet flat on the floor. And the goal is not to lift or strain, but to gently tighten your stomach muscles as if you are getting ready to cough, while keeping your breathing calm and natural, because studies that measure muscle activity show that this type of bracing turns on the deep core muscles that support the spine without pressing on it. To do it safely, lie on your back, bend your knees, relax your shoulders, and gently pull your belly in a little without pushing your back hard into the floor. Hold that gentle tension for about 5 to 10 seconds while breathing normally, then relax. And repeat this 8 to 10 times, resting for a few seconds between each one. And most experts suggest doing 2 sets 1 or 2 times per day. This exercise is very important for people between 40 and 70, because research shows these deep core muscles weaken with age faster than the surface muscles. And when they are weak, everyday movements feel dangerous and painful. But when they are trained gently, many people report better posture, less stiffness, and more confidence within a few weeks, while ignoring core support often leads to repeated pain flare-ups and the feeling that your back is weak even when it is not. This exercise is suitable for most people, especially those with long-lasting back pain with no clear cause. But if you have severe pain that gets worse when lying down, or any condition where your doctor has told you not to do floor exercises, you should change or avoid it and get professional advice. The second exercise surgeons often focus on works on the hips and glute muscles, because research consistently shows that weak glutes force the lower back to work harder during walking, standing, and lifting, which increases strain over time. And this exercise is often called a glute bridge. But again, it is done gently and with control for older adults. To do it, lie on your back with your knees bent and feet about hip-width apart. Arms relaxed by your sides. Gently tighten your core like in the first exercise. Then slowly lift your hips just a few inches off the floor until your body forms a straight line from your shoulders to your knees. Hold for 3 to 5 seconds, then slowly lower back down. And repeat this 8 to 12 times for 1 or 2 sets, resting about 30 seconds between sets. And research in rehabilitation science shows that this slow and controlled movement activates the glutes while reducing pressure on the spine, making it especially safe for people after 40. This exercise matters for your feelings as much as for your body, because strong glutes help you walk longer, stand taller, climb stairs with less fear, and feel more stable in daily life. While ignoring hip strength often leads to more back strain, less movement ability, and a slow loss of independence that many people quietly worry about. For beginners, lifting only a few inches is enough, and progress should be slow, adding more repetitions before lifting higher. And this exercise should be avoided or changed if it causes sharp pain, or if a healthcare professional has told you not to do hip lifting movements. What makes these 2 exercises so effective is how they work together. The core gives support while the hips create movement, and studies show that when both are trained regularly, the spine feels less stressed during daily activities, which often leads to less pain and better quality of life. But regular practice matters much more than intensity, because research on habits and pain management shows that gentle daily movement builds trust in your body, while sudden intense workouts often lead to setbacks and fear. Many people over 40 make the mistake of rushing for fast results, doing too much too soon, or comparing themselves to younger bodies. But surgeons and physical therapists stress patience, slow progress, and listening to your body as key parts of long-term success. Because pain does not always mean damage, but ignoring warning signs or pushing through sharp pain can increase sensitivity over time. As we reach the end, remember this. Back pain after 40 does not mean your body is broken. It often means it needs the right kind of support. And with gentle, research-based movement, many people slowly regain confidence, comfort, and independence step by step. And it is never too late to start caring for your spine in a way that respects your age and life experience. If this video helped you understand your back better, watch another video on this channel to keep learning how to stay strong and active as you age. Subscribe to EverFit Guide for simple and trustworthy guidance. Share your age and location in the comments so we can support each other. And most importantly, take one small step today. Because your future movement and independence are worth protecting.